Okay, welcome back guys. I am Dr. Klim Raza. Today in this lecture we are going to recall your complete entire neuroanatomy. Honestly, if you will stay with me in coming 15-20 minutes, I will help you to recall whatever you have preserved in your medical school decades ago. So we are going to recall neuroanatomy, a very important syndrome. I am going to read this clinical scenario, and then you will answer me first, and we are going to discuss with the concepts. So stay with me guys. Thank you. A 75-year-old man present for evaluation of the weakness. 75 years, 75-year-old man present for the evaluation of the weakness. It's mean old man having stroke or the CVA. And you guys know that stroke, every 90 seconds one person is suffering from the stroke. And among the strokes, the common strokes are the ischemic stroke. Almost 80% people who are having stroke, they are having ischemic stroke, the interruption in the blood supply of the central nervous system, the blockage of the vessels. Rest 20% they are having hemorrhagic stroke. And among these, ischemic stroke, almost 80 to 90% vessel that is blocked, that is MCA artery. And the major culprits, that worse is the diabetes and the hypertension. So in today's lecture, we are going to recall your entire neuroanatomy. Why? Please stay with me. A 75-year-old man present for the evaluation of the weakness. Weakness means patient is suffering from the stroke. He reports that 2 hours ago he suddenly was unable to move his left arm or leg. Left arm or the leg weakness, it's mean left-sided hemiplegia. So problem lies because we know that this corticospinal tract which controls your motor voluntary movements dissociate at the lower border of the medulla, the caudal medulla. So when it's complete weakness, it's mean it's not involving your upper part of the brain, because MCA or the ASA stroke there will be partial weakness, and when it's this tract is moving to the brainstem, it's complete tract. So it's mean if there is a weakness on the left side of the body, the problem lies in the right side of the brain or the brainstem. Let me prove you why in the brainstem. Next, he denies any difficulty with the speech. So you guys know that speech areas are localized in left cerebral dominant hemisphere. So denies any difficulty with the speech. So there is no aphasia, speech is intact, speech is okay. It's mean upper brain is intact. Honestly, MCA is okay. This is a not stroke of MCA. This is not stroke of the upper brain. Especially this is not stroke of the left-sided upper brain, left lobe, because speech areas are localized in your left hemisphere. Next, on examination, he is able to move all facial muscles normally. Now we are descending and moving to the brainstem. First thing he is telling you that he is able to move all facial muscles. Facial palsy is also very common, and this facial nerve originates from the pontomedullary junction. Yes, pontomedullary junction, a territory of the ASA artery and the basilar artery. So another answer that facial nerve is okay. It's mean pontomedullary junction is fine. The lesion is below to the pons. Where does the lesion lies? Okay. Next, there is no ophthalmoplegia, guys. Yes, ophthalmoplegia means paralysis of the extraocular muscles. No ophthalmoplegia means because almost all muscles of the eyeball except superior oblique and lateral rectus, they are innervated by your oculomotor nerve. So it's mean there is no ophthalmoplegia. Eye muscles are intact. You can move your eyeball. Yes, in all directions. It's mean there is no lesion of the midbrain. Why midbrain? Because third and fourth cranial nerve originate from the midbrain, and midbrain is a territory of the PCA artery, posterior cerebral artery, which is a branch of the basilar artery. So it's mean midbrain is fine. Pons is fine. Now move to the medulla. Yes. Anton protrusion, the tongue is deviated to the right. Here is the answer. So tongue is innervated by which cranial nerve? Last cranial nerve, the hypoglossal nerve. Hypoglossal nerve originate medial side of the medulla. And medial side of the medulla, you are receiving blood from which artery? Anterior spinal artery. If you don't know the blood supply of the brain, do watch my lectures on the blood supply of the brain. Anterior spinal artery, which is a branch of the vertebral artery, supply to the medial side of the medulla, and on the medial side of the medulla we are having which cranial nerve? 12th cranial nerve, which supply to the muscles of the tongue. All the muscles of the tongue are innervated by hypoglossal except palatoglossus, which is innervated by 10th cranial nerve. Yes, 10th is innervated, palatoglossus is innervated by vagus nerve. All other muscles of tongue innervated by hypoglossal nerve. So tongue is deviated to the right side. Cranial nerve injury, remember ipsilateral. So tongue is deviated to the right side. Where does this lies? On the right side of the medulla. So medial side of the medulla or the lateral side of the medulla? Because this cranial nerve originating medial side of the medulla, so this is the medial side of the medulla. He is unable to detect lower upper extremity vibration. So he is telling about the dorsal column medial lemniscal system passing through the medial side of the medulla also. So guys, this is your right medial medullary syndrome. Which artery is involved? Anterior spinal artery. This is the stroke of the anterior spinal artery. Stroke of the anterior spinal artery. Let me show you another picture, please. Here you can see. I will not go in details. Just this is your medulla. This is the ventral view, anterior and inferior view of the brainstem. So you can see this is the pyramid. This is only this cranial nerve. So this is your anterior spinal artery. This is the territory of anterior spinal artery. So this is your hypoglossal nerve. Here does stroke lies. So this patient is having right medial medullary syndrome. I hope you found the answer. Thank you for your concentration. See you soon. Thank you.